Well, we are talking about sex. So if anyone out there is interested in this conversation, we're just getting started. I'd love to introduce this amazing panel of women. So I'll start from my left and go down. So first up, we have Dr. Jennifer Lang, founder of Buzz Labs, an OBGYN oncologist and author of Consent. Next up, we have Dr. Jennifer Berman, urologist, sexual health expert, New York Times bestselling author, and you have probably seen her on The Doctors. And then we have Julia Rose, CEO of Kalika Inc. and makers of the Vagini, which I am very interested in. I need to know more about this. And we also have Ms. Holly Griggs-Spall, author and Daisy brand ambassador. Welcome, everybody. Super windy. All right, let's talk about hormones for a minute. Who out there deals with hormones? I mean, I deal with them. I feel like they rule my life. Anyone else? I see a few people that don't, and I'm very envious of that, so I'm not sure what's going on there. But they are the key for our ability to get pregnant, stay pregnant, and later in life maintain our health. Holly, Jennifer, and Jennifer, I'm curious to know about your thoughts on hormonal health and things that we maybe aren't aware of that we definitely need to be made aware of, so that I think our months would be better if that was, I don't know, kind of under wraps.
I mean, I can start. I'm Dr. Jennifer Berman. I'm a urologist. I'm going to leave the premenopause through pregnancy to Jen Lang and the others, but for me, I specialize in sexual health for women during the perimenopause, menopause, and postmenopause. And perimenopause is a really important time because that's the time when we're in our late 30s, maybe early 40s, and we're in our careers. We typically will have had children already that are in school, and we're living our lives. However, we may be noticing symptoms, slight subtle symptoms that creep up on us, perhaps more fatigue, maybe a little weight gain. It's harder to maintain our weight or lose our weight. Maybe we're having difficulty falling asleep or staying asleep is getting more difficult. Maybe we're noticing episodes of vaginal dryness here and there, not every time, but sometimes, as well as declining libido or interest in sex. And we may make explanations for that. Well, I'm really stressed, my husband just lost his job, my son got a DUI, all these things are going, whatever it is. Those are all real things, by the way, that's happening. So that, but life happens, and we can make excuses for that. And that's really where I feel, you know, I made, as a urologist, which is a male-oriented field, you know, coming into it as a woman and carving out a field of female sexual health, or female sexual medicine, they call it, within that specialty was, you know, what was a task in and of itself, but there was a real need. And then being in that area, I noticed that perimenopausal women get neglected frequently because your hormone levels, if you were to have them drawn, look normal within the range. However, you're not feeling normal. So the consensus is changing, whereas before we treated numbers, we didn't treat the patient. Now things are changing, and we're starting to address perimenopausal sexual health complaints as well. During the menopause, it's obvious. By then, you know, you're having hot flashes, night sweats, ready to jump out the window and become suicidal or homicidal frequently. And at that point is when the medical community was willing to treat with hormones. So we're starting to see a shift, and I am a full proponent of hormone balance. I personally aim for bioidentical natural hormones. I'm not saying they're better or worse, but they are, at least as far as I'm concerned, tolerated better, less side effects, and have the same effect as the hormones that you would normally make in your body. They're bioidentical to that. And there's a lot of controversy related to hormones, a lot of questions, a lot of fears, a lot of concerns, and we can talk about that through questions and answers. But I am on hormone replacement therapy, all of them: estrogen, progesterone, testosterone, DHEA, everything, HGH on occasion if people want to talk about that. I have breast cancer in my family, my mother as well as my sister, and so it makes me at heightened risk, higher risk compared to her, many of you. But I went over carefully with my medical oncologist Christy Funk, who was the surgeon for Angelina Jolie, and who told me my risks, being just a woman with that family history, and my risks adding hormones to that. And I personally, and this is how I speak to my patients, weighed the risks and benefits, and quality of life is equally as important to quantity of life. Mental health, sanity, sexual health, enjoyment was important to me. And so that's one of my biggest messages. You weigh the risks and benefits, talk to a doctor that's informed. If you aren't getting the answers that you need, or your questions answered, or that topic addressed, find another doctor, because it's important.
I mean, kind of a quick follow-up question, and I'm probably not the only person that has this question, is two things. One, how do you differentiate between, I mean, we're busy women, like being tired, and like your husband being really, your partner being really busy at work, and kind of that sort of like, what's the difference between needing some hormone balancing and kind of the everyday kind of
Everyday
drain?
stress. Well, the point, that's a good point too, because stress affects all of us, and stress is going to, whether you're 20 or 80, is going to impact health, wellness, well-being, and sexual motivation. So in and of itself, being tired and, sort of a waning interest in sex while you're pregnant and trying to work, you have to take the full picture and the spectrum, and it's not just one symptom. It would be a series of symptoms that have, when you look back in time, subtly crept up, maybe getting a little worse, that don't go away, and adding, now I can't sleep, now I'm getting fat, now I have dryness, now my libido is whacked, now I'm starting to get foggy, I can't remember where I put my keys, and I'm not remembering name. That's kind of. And if you can't right now because you're pregnant, but are you in your 40s? Not yet. So late 30s, early 40s, I'm just going to put it out there. And if you keep your minds open, and all you have to do is be aware. And if you're aware, then then you can speak to your healthcare provider about it. And my clinical experience, and I'm not going to say that this is founded in evidence-based research, my personal and professional experience is when you initiate hormones that are needed early, meaning not when you're in the throes of menopause. During the perimenopause, low dose, based on the woman's symptoms, levels, and needs, it does help to delay and stave off more significant symptoms later. And I believe it optimizes health. I mean, there's risks and benefits to any medication, but from the standpoint of skin, hair, nails, memory, mood, sleep, bone mineral density, cardiovascular health, brain, the protection of Alzheimer's, colorectal cancer, all of those things. So there's positive benefits, and there's also risks, which you need to weigh. But every woman is different, by the way. Some women float through the whole thing without batting an eye. I wasn't one of those women.
I want to hear from Holly.
Well, in terms of, I'm going to take the part of that question about I'm going to take part of that question about what I see as a shift, and I think what I'm seeing is more interest in the benefits of ovulation during our fertile years, and more attention on the research that shows that ovulation and consistent ovulation during the fertile years can really protect our health as we age, bone, heart, and breast health, and also more attention on the research towards the issues with ovulation suppression, so through medications. Okay, does that sound good to everyone? Okay, good. Yeah, I couldn't even concentrate. Sorry. So I think that's a really good shift that I'm seeing, that more people are interested in the benefits of ovulation for long-term health. So you can look up this research. Dr. Geraldine Pryor of SEMCOR, which is the Center for Menstrual Cycle Research, she's dedicated her whole life to looking at the menstrual cycle, benefits of ovulation, issues with anovulatory cycles, and ovulation suppression through medications. So the benefits of it for long-term health, but also for short-term health and how you feel, your quality of life, your day-to-day experience. And I think that's really where I'm seeing the most research coming out, the more interest in research. And obviously, many women don't know if and when they're ovulating because they're not tracking perhaps more than just their period data. And you need to be tracking more than that to know if and when you're ovulating on a monthly basis. So you need to be tracking a fertility sign every day, like basal body temperature, to be able to know that you're not having anovulatory cycles and not just having breakthrough bleeds, but having ovulatory cycles and menstruation, which is really important health marker. We're seeing more around the idea of the menstrual cycle being the fifth vital sign for women, that monitoring it and knowing what's going on from your own perspective and from your healthcare provider's perspective is really great indicator of your overall body health. So I think that's really what I'm seeing, the two topics.
So what happens, what are the benefits of what it sounds like is that you're advocating for not using hormonal contraceptives there's benefits to them for women that aren't, for acne, for serious menstrual cramps. I'm not a gynecologist, but I'm just wondering what the benefits are of not inhibiting that medically. If you don't use hormonal contraceptives,
like guys essentially not really ovulating, right?
Well, not ovulating, we know that there are certain cancer risks that are reduced.
Well, I would say, first of all, I'm not advocating for anything. Every woman's choice is their own. All I advocate for is informed decision making and informed choice. I'm absolutely aware that for some women, ovulation suppression is not only their choice, but actually absolutely beneficial to their quality of life, even life-saving for some women. So no, I completely appreciate that. I only advocate for informed choice. So when I say ovulation suppression, the most common way women suppress ovulation during their fertile years is with hormonal birth control. Now, most of you probably know you're not ovulating, but you're also not menstruating on most forms of hormonal birth control. There are some that you will. The benefits of not using it, well, from my perspective, like I said, the research around long-term health and short-term health, quality of life. My experience was that I had taken hormonal birth control for 10 years and it gave me very severe depression and anxiety. So that's kind of my area of expertise. I talk a lot about the mental health side effects of ovulation suppression through birth control, but that's not the only thing that it's doing that causes that. So that's my background.
So I am a gynecologist. I could chime in on so many different points that have been brought up, but I think I'll step in, put on my oncologist hat right now, and just comment that this data is very confusing and it's very difficult to unpack it. And even amongst the experts in, the endocrinologists, the menopausal experts, there is such widely variant perspectives and thoughts about the safety of these medications. I'll just say I am also like a food as medicine practitioner from the Center for Mind-Body Medicine. We can do so much with diet, lifestyle, stress reduction, improving our relationships, having some help with the dishes from time to time, and that really affect desire and sexuality. My perspective is always to start with, the basic fundamentals of health and wellness, and kind of move to medication further down that path, because just last year we had updated results from the Women's Health Initiative recently claiming a decreased risk of breast cancer with estrogen-only therapy, and the Million Women study showing increased risk of breast cancer at every dose with every combination of hormones. So, this mindset that women should be placed on medication preventatively for, to prevent possible health consequences down the road, it seems to get challenged again and again, and we see that it's not always so simple, and there can be some serious consequences. So, I don't know, breathe, sleep, yoga, eat plants.
A follow-up question is, before you get to the perimenopausal stage, as a gynecologist, when do you suggest women like myself go in for checking to get hormonally balanced?
I don't recommend that.
I'm going to chime in here. I do recommend it, and you want to know why? This is what she just said. The controversy, and the reason we do, and we're friends. And the reason for that is this: when you become menopausal and you really are having more severe symptoms, we don't know where you were when you were feeling your best and when you're feeling okay. Your estrogen level might be 30, mine might be 202, hers might be 48. So I think it's if there's an issue or an option or a way to sort of get an idea, maybe through menstrual cycles or whatever else, to have an idea of where you are hormonally when you're ovulating or when you're at your best will be useful information to use later. That's the only reason, not necessarily, for treatment, because you're going to, any day of the week that I look at your hormones after you have your baby, it's going to be different, 20, 42, because you're perimenopausal. That's what happens. We go all up and down. So it's good, useful information to have just for yourself, if nothing else. But not necessarily, I agree with her that it's not like you have to jump to do something about it and you need to get labs to get tested. But it is useful information.
All right, perfect. I mean, I think we could talk about hormones all day long. But another fun and exciting topic, the pelvic floor. I'm excited to hear all your tips and tricks to keep it intact, the importance of doing so, and any other thoughts.
Why don't we start with Julia, because she hasn't spoken yet.
Sorry, is this all over? It's the mic game. So pelvic floor is my world right now. So I just, as a brief background, I've been creating a product that helps women strengthen their pelvic floor muscles, and it's based on an experience I had giving birth in France. I have 2 little kids, and the older one was born in France, and I found out that every single woman, after you give birth in France, gets to participate in this program where they help you with pelvic floor muscle recovery. And it's essentially a biofeedback, gamified pelvic strengthening program. The bottom line is you're playing video games with your vagina. It's fucking awesome. And I'm sorry, maybe I shouldn't swear on this panel. Sorry. So I sort of fell into learning a lot more about the pelvic floor through that and creating the product I'm creating. And I think it's really great that we're sitting here and talking about all these subjects like the hormones and our fertility. And it's important because these are things that traditionally I don't think we've talked about all that much, and I'm so happy that the tides are changing. There's shifts in cultural awareness around all these women's issues. It's so important, and we're only at the beginning. And I think the cause of a lot of our daily struggles are mainly because we have not normalized these things. And so I'm really, first of all, honored to be here on this panel with these other women because they are champions of these sorts of conversations all the time. But I really think it's so important that we just continue talking and talking until this is so normal, it's like brushing your teeth. So pelvic floor specifically, just quick background is you have a set of pelvic floor muscles. They sit in your pelvis. They connect to your abdominal muscles and lower back. There's a whole bunch of them. It's probably much more complicated than I know. These women will know a lot more than I do. But they're responsible for a bunch of things, including supporting some of your main organs, your bladder, your uterus, your rectum, your vagina. And often, because we don't really address this part of our body, they will become weak. And they can certainly become weak after pregnancy and childbirth. But they become weak for a whole bunch of reasons. If you're a high-impact athlete, like a runner, if you've had surgery, if your hormones are going crazy, so many reasons. And as a result, it really is important for most of us, really all of us, to at least pay attention to this part of our body and keep them strong and healthy. So I think the conversation starts there. And in doing what I've been doing, I've certainly noticed that this is a conversation that has been interesting to bring forward into the world. I do want to cut out and say there's the funniest video online of Dr. Berman talking about a similar kind of product with Conan on late night, wasn't it? Yes. Oh, so just Google that. It's hilarious. It is a competitor of mine, but it's fine. But it's really important, mainly just because it's making this a normal conversation. So that's one note. And then I would say, I guess, I don't know where you want to take it, but it's really important to find a way for each of us to start addressing these problems, because what happens in the end is whether we're peeing our pants a little or we're having prolapse, which is where one of these organs I mentioned starts descending in the body and falling out, essentially, or pain, hip pain, back pain, sexual dysfunctions, which I think is the focus of all of this. And by the way, of course, ultimately, depression and mental health issues. As women, we sort of take a lot of these things in stride, and we have to wait until they get so bad that maybe the only option at that point is surgery. And I just really am a proponent of trying to catch these things early, trying to make sure we're all very in line with the conversations we've been having. Just check in with yourself. And when things are starting to go a little wonky, maybe your downward dog is like, whoops, I let a little bit out there. Whoops, how did that happen? Maybe check in and talk to your doctors, talk to anyone that's an expert in the field, and see if it's something that will benefit you to do some sort of pelvic floor physical therapy in some way.
The only thing I see with downward dog is my saggy stomach and knees.
And the knees.
What do you suggest for strengthening the pelvic floor? Because you have a product.
I do, and I'm addressing something very specific, which is a weakened pelvic floor, not things that may, there's other blanking on words, but problems we can have that maybe these exercises are not good for. So I'm just going to preface this by saying talk to your doctor or whomever is taking care of you. But what I've created is a product that, okay, here's the thing. It's essentially to help you do Kegels. The problem with Kegels, we kind of all know about them, I'm going to guess most of us. The problem is they're really boring, and they're also actually really difficult to figure out how to do. You may think you're doing them right, but I'm going to guess most of you are not, based on nothing super serious, but like OB-GYNs.
You're doing one right now.
That's
I was like, can I still
by
do
the
it?
end. Yes, exactly. So what we do is essentially, I think was the goal of this French program, is we not only will teach you with this product we've created, which I'll explain in a second, how to do it correctly, but we make it fun because you are going to be playing video games that are controlled by your Kegels, and the video games are really fun. So that's the basic idea, and we track and chart your progress. You can see, how you're doing over time. We calibrate to each of our bodies because we're all physiologically different, and we want to make sure that, just because your body's built one way, you're not at some sort of weird disadvantage. So that's the basic idea, and in doing so, the good thing about what we're calling Kegels, although Jennifer and I are on a mission to change the name of it, yes, because that was a man who created that name. So for now, we're working with pelvic wave. We'll see where we go with it. But the great thing about it is you don't have to do it all that often. You don't have to do it, but you should just do it consistently. So if you're even doing it for a few minutes every day, you're going to see results, most likely. So that's it. So in the essential, yes, we all know the basics. I'll tell you real fast for all of us who are not doing our Kegels. You can try one now. You want to first squeeze as if you're stopping the flow of urine. And then, we should sit properly. We got to sit with a little bit of arch in the lower back, kind of let your belly hang out, that belly we were talking about. Let it hang out, relax for a second. Now do that squeeze where you're stopping the flow of urine. And now imagine, while you're squeezing, pull all of that up towards your ribs. Hold it for a second, and now let it go down and relax out. And relaxation is just as important as the contraction.
Are you supposed to hold it for?
You are, and you can do quick ones. You can hold and count to 4, 5, 10, whatever you're able to. Do them on repeat. That's just the basic movement. And then from there we can do all sorts of things. I want to get to the point where we play each other, through my product's called the Vagini, play your friends. So that's what I'm doing, essentially. Lots of sexual benefits too, by the way.
I feel like this next question just parlays perfectly into this, which is, how does having a really intact pelvic floor play into your sex life?
Well, I think I'm going to just backtrack a little bit, is when you after you've delivered babies vaginally, and we all have heard about, Kegels and to do them in our pre-pregnancy, but after you've delivered a baby vaginally, or 2 or 3, and then you get older, I don't know, most of you don't look as old as me, but it's hard to do them. It's like, Kegel what? And And so that's why these home tools, the things that you can do at home. There are lots of options in the medical offices now for gynecologists and urologists to help increase pelvic floor strength and tone. You could sit in the M-Cella chair. You can have a Votiva, Diva, Thermiva. There's all these radio frequency heat and laser modalities, but these are things that you can learn how to do and do on your own at home. And it's important that you do them. Well, I'm going to go back to my prevention thing, like with hormones, that when you're young now, start now, build up the muscle strength and tone now, because it does help to prevent stress incontinence, which is leakage when you cough, laugh, sneeze, which happens. All of us are going to experience that in some way, shape, or form during our lifetimes, even if for a limited time. Urge incontinence frequency, prolapse, falling of the bladder, falling of the rectum, bulging of that, and also loss of sensation. With lack of Kegel strength and with aging and menopause, there's less tone. You get that women will complain that it feels sort of loose. There's less sensation. It's more difficult to achieve orgasm. And the Kegels function to trap blood, so it kind of engorges. It's like yourself a little erection, even though the clitoris becomes engorged, not erect. But it's a way to optimize sexual arousal, and also during sexual activity and penetration. If you can use your Kegels during sex, the in and out motion of it, that also optimizes sensation for your partner as well as yourself. So.
We don't have to be totally heteronormative on this panel, so assuming you have a male partner with a penis. But if you think, like, what is an orgasm? Like, what is actually happening? It's rhythmic, involuntary contractions of the pelvic floor muscles. So if you think of the pelvic floor muscles like, the biceps, say you go to the gym and you do repetitive bicep curls, what's going to happen to your biceps muscle? It's the muscle fibers are going to hypertrophy a little bit. There's also going to be improved growth of blood vessels delivering oxygen and more blood to the area, so the engorgement that Jen was talking about. And so by keeping those muscles fit and perfused with blood and oxygen, they are on track and ready for that awesome, explosive, rhythmic, involuntary contractions. So orgasm quality.
Yeah.
Definitely.
Two things to that. One, and this might be a little TMI, but it's this kind of panel. Clearly, because of what I'm doing, I test a lot of different types of products that are to do with my pelvic area and my vagina, and we do a lot of those squeezes. And I've noticed that it does take you a little bit down that road. Like, you're already like, oh wait, I'm halfway there. Like, this is kind of so. Just to that point, that all the blood flow and the engorgement, it does happen, and it does. I don't know, maybe it's what you do before your husband's showing up or your wife or whomever, Anyway, that's number one. Number two, I will say the other important thing about even just being aware of your body, thinking about doing these exercises, is now you're connecting emotionally to something that so many of us, I would say, in my age group, we have been separated from. We were sort of touching on this before we started. There's a separation to function and survive in our world, a little bit of our feminine energy, history, all of those things. And even just, yes, we want all those health and fitness benefits. Those are incredibly important. It is important to do preventative. It is important for your pleasure. It's important for all of that. But it's also important to just reconnect to a part of our body that a lot of us have found our way, sort of strayed away from. So even just saying vagina, by the way, just on that quick note, one of my very first meetings with like a whole room full of men when I had to come and talk about this, and you doctors, you guys must deal with this all the time, but like it was the very first time for me, and I barely said the word vagina myself at that point. And I remember walking and seeing all these suits, and I'm like, oh my God, what am I going to do? And so I remember just saying, okay, so gentlemen, today we're going to be talking about the vagina. So I'm just going to say it 3 times so that everyone's comfortable, right? Vagina, vagina, vagina. And then I realized, I was doing that for myself. I had no idea, I didn't even care what they were doing. I was so, my vagina. Now we talk about it all day long.
I think our last topic that I really want to touch on, you have a new book called Consent that's coming out. Or came out, sorry. Came out. And it's talking about teen sexual health. Do you want to touch upon that and how that parlays into even our lives as we get older?
Sure. Well, as Julia was talking about women being disconnected from this part of their bodies, I think history of sexual trauma is one of the, unfortunate, most common reasons. Nearly a quarter of all of us have experienced that at some point in our life, possibly more. Everything is so underreported. So I think that as we talk about these things, think about these things, connect in an embodied way to parts of our bodies that perhaps we have left or neglected for any number of reasons. Consent, the title of my book, is really important. And, I wrote the book for teenagers. I dedicated it to my teenage self because it was information that I wish I'd had as a teenager. And up until quite recently has been really hard to find. I think that just post Me Too movement, there's been a proliferation of consent education. When I wrote the book, the preeminent textbook on the subjects for teens had one paragraph out of 400-page textbook buried right in the middle that talked about consent. And I'm like, no, it's the whole thing. Like, we need to begin every sexual experience, interaction, partnered sexuality, with checking in with ourselves about what we really want, figuring out what feels good, being very clear with our voice and our bodies to communicate that, and proceed in each moment from that perspective that we're only doing things that we genuinely want to do. We're not dissociating. We're not, sacrificing what we want in order to please or pacify someone else. I could go on about this.
I mean, is it a book that, as a mom, I should be reading, or is it something that I should be buying for my teen?
I haven't found an adult who hasn't found something in the book that they're like, whoa. And even myself, in the process of writing it, came to some of my own healing, which has been incredible. Literally after decades of being stuck, through the process of writing, I found healing, and I've had tremendous forward motion in my life since. So, but as its target audience is ages 13 to 25. My 11-year-old daughter has read it, but she's, exceptional.
And boys should read it.
And of course.
I have 2 boys.
Yes. Oh, it's so important for boys. Of course. It's,
Is this like a mom and child read at the same time and kind of unpack it together? How do you suggest?
Could be, or it could be like leave it on their desk and don't say a word, and just pretend you didn't put it there, and just yeah.
It's a conversation, though, that moms need to have with both. I missed but my son is gay, and he's 21, so I missed that, he's engaging, but for my daughter, who worked with Jennifer also, she's an activist and women's rights proponent. It's a powerful message, and what I learned through listening to Jen and through my daughter is that I don't know whether I not so much I'm going to take sex out of the equation, but allow behaviors to happen to me, touching, comments, even people that men that will do something, say something, graze, whatever it is, in a way that I get that creeped out feeling, and I don't say anything. I just sort of scurry away and pretend, like I didn't really notice that or hear it. And I realized that I'm enabling that kind of behavior. And that's where, when I talked to my daughter, I said, you girls are teaching these boys how to behave. The onus is on you too, us too, to say something, to use our voice, to not be quiet, to not shirk away.
Agree and disagree, okay? Because, there's actually a powerful study done on this. So men in general tend to react with violence and anger to being rejected. So it can be a survival tactic, and I don't want to right, exactly. And fragile egos, right? Feelings can hurt. And I don't want to put the onus on girls and women. I think we all need to, be more in touch with what we authentically want and desire, and more comfortable to communicate that, but it's everybody's responsibility.
I wanted to chime in just really quickly. I think it's a really interesting side effect of fertility tracking, menstrual cycle tracking, that you get to talk a lot about consent. And I do workshops with women all the time, and it's amazing how many red flags come up when they start talking about fertility tracking, where they're not able to have conversations with their partner that maybe they've been with for years about when they're fertile, what that means, different kinds of sex that they might like, avoiding PIV, penis and vagina sex, at certain times of their cycle. And it brings up so many conversations, like instead of just shutting it down and putting it aside and saying, okay, that whole fertility thing's taken care of, you're actually engaging with the other person, teaching your partner about the fertility cycle, about the menstrual cycle. You're learning together, and you're having so many conversations, like big ones about whether or not you want kids, but also smaller ones about like, well, we've always done it this way, but maybe I want to try it this way. You know, we have some time in our cycle where I don't want to have PIV sex, so we can try these things. And it's actually been a really interesting conversation as a result of doing this work in the fertility tracking world, and advocating around body literacy, is that like I feel like it starts with like us knowing our bodies in that way, and then we get to have those conversations because we feel more confident, we feel more empowered, we feel like we have that knowledge on our side. But I totally agree with you that it's not our responsibility to do anything.
I mean, I like it. It's just about bringing normalcy to things that are half the population. I mean, it's we all deal with it. Hormones, pelvic floor, fertility cycles, and different things. But I know that there's a lot of questions out in the audience. Does anyone have any questions? Anything?
No questions?
I feel like 1,000 questions.
Yes?
Question. My name's Jessie. I work for Baby Physical Therapy. We work a lot with pelvic floor patients and pre and postnatal. And so I want to start by just asking oncologists and OBGYN, how often do you guys refer patients for pelvic floor work throughout just a woman's journey in life?
For pelvic floor physical therapy, I use that. You know, I have all those devices and treatments, and you know, the Votiva, and home units. I'd like to get samples of yours too for my patients. When I use physical therapy, it's usually for the opposite, teaching them how to relax the pelvic floor. So if they're hypertonus or vaginismus, pelvic floor spasms, that's when I have used vaginal physical, me personally, and it's really the only thing that we can do to help for the biofeedback aspect things, the trigger point massage. There's something that you guys do with a light, a laser, or something along those lines that's been helpful for my vulvodynia and pelvic floor spasm patients.
Wonderful.
I have a question.
Yes?
Oh, are you done?
Yeah.
Yeah, I have a question. So you guys touched at the very beginning about hormone therapy, and you know, you, Jen, felt differently than this Jen, and it's just such a crazy spin. I mean, I wanted some analysis. I wanted to be an evolved woman who like was on top of it, and you know, as I entered menopause, and I paid for a very expensive, fancy hormone doctor that so many of my girlfriends are going to, and I went and had all the tests, and we had a wonderful sit-down session. She told me every hormone. I learned a lot. It was really interesting. And but then she killed
She
it.
lost her license, right? That one?
No, I don't think so.
There is one,
But
prominent
listen,
one in
but
LA who did.
then what killed it for me there was she said, well, to be on all my potions and medicines in my program, which several of my girlfriends love, you have to come back for a blood test every 3 months. I don't have that kind of schedule. I'm super busy. Like if I had cancer or something, I'd go get a blood test every 3 months. I would do it, but I know myself, I won't commit to that regimen. So then I went to my OBGYN, who's a progressive, integrative, and I'm like, what would you do? Like, how do we test my hormones? What do you think of this? And she said to me, forget about all that hocus pocus. How are you feeling? That's how I diagnose. That's how I'll okay, you need estrogen. You need a little testosterone. Forget about the blood test. That won't tell me anything. My head was like spinning and just like dropped off.
You do need baseline, sort of a number. But like I said earlier, we treat patients, not the numbers. And you don't need to do it. Certainly, are you in your 50s? At that, you do not need to be doing it every 3 months unless she's putting things in off-label like testosterone or compounded DHEA or pregnenolone. When you go that route, you kind of do need to check levels. But if you're doing standard, FDA-approved guideline hormone replacement therapy, you don't need to be.
So my OBGYN was right then?
Yeah. In that sense, unless you were taking testosterone, DHEA, growth hormone, other things like that, that you do need to monitor levels a little closer.
Did I do the right thing by going to a hormone doctor?
Yeah, you did because you got educated and you got on them. And the managed care GYN offices don't have the time to talk to you like that. At least if you're going under your insurance.
It was just such a buzzkill to pay all that money and get all those results, to be really excited, like, okay, I'm going to be on top of it and proactive in 20, and then like, but you got to come to me for a blood test every 3 months. Like, are you kidding me?
I mean, my concern is, as an oncologist, I've seen the patients come out of those practices who have been essentially given unopposed estrogen with uteruses, which is a huge risk factor.
What
I
is-
mean, drives their
What is unopposed? estrogen?
unopposed means if you have a uterus and you're given only estrogen and not progesterone, it just stimulates the lining of the uterus and it builds up and you develop endometrial cancer. And
Why would a physician do that? I mean,
so
even I know
so
that you're not
it's
supposed to do that.
differences actually with absorption usually of transdermal bioidentical testosterone, which is absorbed, and not to mention the compounding pharmacies and the wide variation of what's actually in the medication that gets made. So there is no standardization. I mean, this is a whole other conversation, but to me it just speaks to like the stuff is, it might be natural or it might be, under the guise of something that's natural, but really what's natural is for our body to be exposed to reproductive hormones for a certain segment of our lifespan, and anytime we mess with that, that's not natural. So
Interesting. Thank you.
So, there are bioidentical hormones that are FDA approved, studied in thousands of women, where we know at every minute of the day the exact microgram dose that's being absorbed. By natural and bioidentical, I do not mean compounded, some guy is stirring them, and because there are problems with that. There's variability in each batch. The absorption is different in each woman. It's different from woman to woman, this pharmacy versus that pharmacy. That's the problem. But the other problem is that there, up until recently, there were no FDA approved treatments for low libido in women. Now we have 2 FDA approved drugs. 4 years ago we didn't. So doctors were, such as myself included, were having to use things off label. Based on my fund of knowledge, my clinical experience, I was able to make the decision, weigh the risks and benefits. Do I feel comfortable prescribing this medication in this dose? But in those circumstances, you do have to monitor closely. But she was monitoring closely when she didn't have, that other lady didn't have to do it. But I do want to just make you all aware that bioidentical natural doesn't mean that it's a guy stirring it. There are FDA approved medications that you can buy under your insurance that are natural, meaning that they're synthesized from plants instead of a synthetic molecule, compound, or other.
pregnant horse urine.
Or horse or pigs.
So, can you talk a little bit about the HGH that you're using now, but backtracking also, there's also DHEA that you can find at Lasson's and creams and whatnot. I mean, what are your feelings about that? Just as like a precursor to them going on the bioidentical hormone replacement.
The progesterone, when you're using it in combination with estrogen, is at the regular dose. When people are taking progesterone cream that are menopausal, I think that's not the standard of care. You can take regular progesterone in a capsule, the regular dose. It should not be delivered in a cream for the same reasons that we talked about just a second ago. You don't know the batch, the dose, what's getting absorbed. And if you're on full strength estrogen, you need to be taking progesterone. It's FDA approved. It's covered by your insurance. You can get it at the pharmacy. It's natural. That's not derived from pigs or horses or other compounds. In terms of DHEA, that's a whole nother story. That's an adjunct. DHEA is an adrenal gland hormone. It's a precursor to androgens, or precursors to the formation of testosterone. It also, DHEA tends to decline with age, and very much so in stress, which then puts more stress on our adrenal glands. So adrenal gland support, DHEA is not the only, it's over the counter. It's not the only over the counter supplement. There's other supplements for adrenal gland support. HGH, you mentioned, is not FDA approved for use in women, men, or anything. It's FDA approved for people with short stature to help, and also for wasting, like muscle wasting and AIDS, and for people that have hypothalamic or pituitary dysfunction that aren't making enough. However, it is used, if not overused and abused, by professional athletes because it increases lean muscle mass versus fat mass, increases performance, endurance, skin, hair, nails. It's used and overused to some degree in longevity and anti-aging centers in combination with other hormones and other things for its anti-aging benefits. It is the main regulator of the entire neural endocrine axis, so the ovaries, adrenal glands, thyroid, but there are definitely risks for that. And if you are even considering it or read about it or taken it, you do need to be under the care of somebody that that knows what they're doing and that is delivering it properly. It needs to be low dose, cycled, it's refrigerated, it's a whole ordeal around it. But there are benefits to it in controlled settings, and I have used it. I do use it.
I know that we have to wrap up, sadly. This panel has been amazing, and I know there's a lot more questions out there, so you might find our panel of experts around and ask your questions after this. Thank you guys so much.